The National Highway Traffic Safety Administration claims that more than 3 million people sustain injuries each year in car accidents that take place across the United States. While the accidents themselves and the injuries sustained may vary, there are some injuries that are a lot more common than any others. Some injuries may heal within a matter of days, whereas others may be permanent. The severity of the injuries and the type of injuries that occur can depend on a range of factors, including whether a seat belt was being worn, where the car was hit, from the side, front, or rear, the direction the occupant was facing, the direction the occupant's body was turned in, whether the car was traveling quickly or slowly, whether the car had airbags. 2 categories of injury. There are 2 main categories of injuries that are caused by being involved in a car accident: impact injuries and penetrating injuries. Impact injuries. This type of injury is usually caused when a knee, for example, hits a part of the car's interior such as the dashboard. Penetrating injuries. This type of injury involves a cut or a scrape. Glass that's shattering or objects flying around the inside of the car frequently cause penetrating injuries. Cuts and scrapes. When a car is involved in a collision, any objects that are loose can become projectiles. Projectiles can be anything from GPS systems, books, cell phones, coffee mugs, and anything else you keep in your car. Everything that happens to be loose can potentially hit you and cause a scrape or an injury. While some scrapes or cuts may be quite minor and are likely to heal in a few days, some may need stitches. You should be aware that if you have an airbag, you may suffer from cuts and scrapes if the airbag is deployed during the collision. Soft tissue injuries. Soft tissue injuries are caused by damage to the connective tissues, in other words, tendons, muscles, and ligaments. This is the most common type of injury resulting from a car accident. Soft tissue injuries can take many forms. Whiplash is one of the most common soft tissue injuries, and this injury is caused by sudden movements of the neck and head. These sudden movements cause low to mid-back injuries such as muscle sprains. Occasionally, more serious injuries may be caused simply due to the impact against the spine. Head injuries. Head injuries can be quite minor, but they can also be pretty severe too. When a car suddenly has to stop or change direction, your head can move suddenly and unnaturally. While the back and neck can be injured, the head can also be injured. An impact with a steering wheel or side window can cause bruising and scrapes. Occasionally, deep lacerations may occur. Severe collisions can cause what is known as a closed head injury. This type of injury involves tissue and fluid inside the skull becoming damaged due to the impact or sudden movement. Injuries that are less severe often result in concussion, whereas some of the most severe accidents can cause permanent brain damage. Chest injuries. Chest injuries are a common occurrence, and they usually involve bruising or contusions. However, they can also be more severe and include internal injuries or broken ribs. Many chest injuries are caused by the driver hitting the steering wheel. If your body is thrown forward in an accident, the chest will experience a lot of force against the seat belt. This could cause a lot of bruising. Leg and arm injuries. If your car has been hit on the side, your legs and arms are likely to be thrown quite hard against the door. If you're traveling as a passenger, your legs will not have much room to move. This means your knees could hit the seat in front of you, or the dashboard depending on where you are sitting. You may receive scrapes or bruises or scrapes if the accident is not too bad. However, you could also have breaks or sprains. Please be aware that some injuries may not be obvious immediately after a car accident. Some may take days or even weeks to appear. If you are involved in a car accident, you should always get medical treatment even if you only feel slight discomfort. If you have been involved in a car accident and you or the other driver were injured, please speak to a personal injury lawyer as soon as you can.